Welcome to the InfoMullet YouTube channel. If you enjoy this content, please like or share. And if you'd like to support the InfoMullet by becoming a mulleteer, visit us on Patreon. We appreciate your support. Okay, let's go ahead and get started. Welcome to today's InfoMullet. It is Wednesday, July 15th. I am Timothy Clancy, your Chief Mulleteer, and this is Bonky, the Emotional Support Donkey. Today we're going to talk about school reopenings, which everyone wants to talk about and has an opinion on. So we're also going to get into a little bit of what's going on with the second stimulus bill, which I know there's a lot of interest, and a little bit of foreign affairs with South China Sea. So if you haven't yet, like or follow the InfoMullet Facebook page. Check out our YouTube channel. When we're done with this video today, I'm going to download it and upload it to YouTube in its entirety on Friday. And then next Thursday, all the clips that come out from these videos where we break up the segments, those will go up next Thursday. If you haven't yet, join us on Patreon, support the InfoMullet. It's www.patreon.com/InfoMullet. $5 a month lets you become a mulleteer. And we greatly appreciate all the support and the help. And it helps make these sorts of things possible, plus the website and all that other stuff. So again, if you haven't yet, check it out, www.patreon.com/InfoMullet. I am recording, Jennifer. Thanks for checking. This is live and recorded. I did hit the button earlier this time. So the context for today and this big discussion of school reopenings, let's do a review here. Schools began shutting down along with everything else, and they were sort of naturally reaching the end of the school year. And early on, I predicted they weren't going to open, before the end of the school year. That came true. Summer's coming, but we're now in the point where schools will begin reopening under a normal schedule. As we've moved back to school year, some are opening in August, some may open in late July. All of them are going to be opening in September. And the question, this is a normal year, and 2020 is anything but a normal year. And the question that's been building is, can we reopen schools safely with COVID-19? How do we do it? And there's two categories of school. We're talking, adult learners, universities and colleges with all of they provide. We're going to go over that. But we're also talking primary, secondary, elementary, kindergarten, middle school, high school, all the schools where people from as young as 4 up to 18 years old are going to be. And I think the context of this discussion, if you think about moving the workforce online is a barrier. You talk about problem types. It's a barrier. Once you get over it, you kind of adapt to it. Dilemmas, a type of problem with dilemma, there's no easy choice. There's no good answer. And I want to be really clear up front that with schools, I understand there are consequences for keeping schools closed, and there are consequences for keeping, having schools open with the COVID-19 risk. In a dilemma, by definition, you don't have a good option. You're picking between least worst options. Quandary is a dilemma where there's a high degree of ambiguity, and that's where we exist in the COVID-19 space. We don't know everything we could know. Some problems don't have a good answer, but at least you know everything you need to know. With COVID-19, we certainly know a lot more than we did in March or February, but we still are learning a lot. There's still this discussion: is it a respiratory disease, a blood disease? Is it airborne? Is it droplets? What's the long-term consequences, lung versus brain? So it's a high degree of ambiguity, and a quandary becomes a predicament when your time for making that decision has run out. And I would say right now we are in the predicament stage where schools are basically running out of time, and everyone has started jumping into this conversation the last couple of weeks, helpfully or unhelpfully, and we'll go over some of that here in a bit. So all of this is coming together to create this predicament situation where schools are having are being asked to balance these, which is the least worst option. What is the information we know and don't know? And what I wanted to do today was kind of go through those different categories, starting with universities and colleges, because there's some research data there that I'm going to use as a way of framing this that will then also, I think, dovetail into the lesser schools. So the first thing is, when you think about a university campus, you can model that as an entity. And some of the research, there's lots of discussion about, and I'm going to stay fairly high level here. There's lots of discussion about, cohort spacing, or how far Johnny's desk is from Sally's desk, or, all these different tactics. I want to start at a high level and just say, can a university be made safe? And fortunately, the National Institute of Health came out with some research. It's preliminary, it's pre-peer review, so keep that in mind. But I looked through it. The link of this is in, all the links for the discussion today are in the bottom. And what it took was it took a sample 5,000 student college. It used an SIR model, which is the susceptible, infected, recovered model that we've used throughout. When I first did my article on COVID-19 in January, I talked about the SIR pandemic models. Now it made a few modifications, but it's using a robust model. And what they wanted to do was to test, is there any way with testing and isolation that you can make a university safe under a variety of conditions, and what does that cost? So, I mean, before we talk about necessarily distancing or very tactical things, this is a really strategic question. Is there a solution that's viable with this general question of infections and testing? And so what they did is they tested 3 scenarios for an overall community spread. And the base case of community spread was an R value, this R aught value, which we know is the rate of infection, right? An R value of 1 or higher means you're in a outbreak scenario. 1 or lower, it's decreasing. And if you have like an R2, that means for each person who gets infected, 2 more are going to get infected. So the base case was an R2.5. They did a worst case of an R3.5, and they did a best case of R1.5. So right there, they took 3 levels of community spread. Then they tested in the model your testing frequency and whether you're testing all students every day, every 2 days, every 3 days, every 7 days. Now, I already hear Jennifer laughing about testing all students, you know, and reliably doing it. So this is a model, and there's certain assumptions like you can perfectly test all students and get kids who can't even show, I shouldn't say kids, young adults who can't even show up for class on time to, you know, hit the testing marks on a regular basis time over time. They looked at testing sensitivity. So that the frequency is how often you're running these COVID-19 tests, right? The testing, they did a range of sensitivity tests, and they looked at sensitivity and specificity. Now, sensitivity is the rate at which is called the true positive rate. And that right now with COVID is between 70 and 99%, depending on what you're using and how expensive a test you're getting. And this, the inverse of the sensitivity, we think of that as the false negative, or excuse me, the false negative, where you actually have it, but the test came back that, you know, you didn't have it. This is why that range is really dangerous, because if you have a sensitivity of 70%, that means you might have 30% false negatives, which is what we've seen, as that people get tested as if they're clear, they still have it, they spread it. They also had a range of specificity rates, which is the true negative rate. And these with COVID are much tighter. You know, you're talking between a 98 and a 99.7% specific rate with the test. And the inverse of the true negative is the false positive. So if you have a specificity of 99%, that means out of every 100 people who test negative, or excuse me, test inverse positive, basically it's someone who is testing positive but isn't really positive, right? And so then they did this model over an 80-day semester, 5,000 students, and they had different exogenous facts come in with infections coming in from outside the campus and all this. And they have the costs of these tests. And one reason I use this research is because it's easy in isolation to say, hey, yes, testing every day at the highest level of sensitivity and specificity and all this staff, and that costs money. And this money is a question that all universities are going to have to face. And I pulled this because in some ways, this is a proxy for high schools, for kindergartens, for other things. You're talking about, can you have a safe testing environment? And their policies were, if anyone tested positive, they would quarantine them in an isolation dormitory. So they'd remove them from the population and until a second confirmatory test. So the second test was to confirm that the first test was right. And what we found out was fairly interesting. So let's jump into what they did find out. First of all, I'm going to show, it's kind of a busy table. They did a lot of these scenarios, and this is what the results look like in the research. So this is, you can see here those parameters I just described. How frequent are you testing? The sensitivity rate, 70, 80%. The cost, overall cost to the university, the total infections out of 5,000 they had, and then this incremental cost effectiveness ratio, which is basically a dollar cost per infection avoided. And when you see over here, you see these phrases dominated. That's a game theory phrase. This is using a little bit of game theory, but it basically says this is no better than, you know, an earlier version. So you would, you would not get any incremental benefit from having done this. And you can see here, the top is the base case and the bottom is the worst case. And on the next one, I'll go to the best case. But I just want to point out these costs on these range. So you go from weekly to daily, low sensitivity to high sensitivity, and you're talking a cost over 80 days of between $700,000 and $20 million, right, for a university of 5,000 students, right? So right off the bat, this is a very expensive thing. This is not going to be, forget all the infrastructure changes, how much it costs to redo class design. This is just testing and the quarantine costs, right? So you're talking a very expensive, and it's similar for worst case. The cost of testing doesn't change that much. And even in the best case scenario, excuse me, here we go. You can see here this cost range is again ranging from 500,000 to 20 million. Well, from these cases, there's a couple things they found that were common. First of all, law of large numbers is important, right? You're talking 5,000 students. So even if you have a specificity of 1%, you're going to have some people who get a positive test that's actually negative, and they're going to be quarantined in a dormitory and go through all the stress and, am I really sick, until that second test comes back and clears them. This will create anxiety. It may also expose them to people who are actually infected. But when they ran all these tests, what they found for the 3 optimal scenarios for each community spread is that the frequency of screening was far more important than the sensitivity of the test. You could actually have, it was more important to have more frequent tests than it was to get a super precise test and only have it 1 day a week. That makes sense if you think about it, because you can get affected on any day of the week. And if you're only getting tested every 7 days, then there's 6 days between we catch you after you get infected, if you get infected the day after the last test. So the optimal scenarios for each type of community spread are listed here. And again, its base case is a general community spread outbreak, worst case, and best case. And the optimal policy in a base case is screening every 2 days. Jennifer Q. Laughter. At 70% sensitivity, it costs about $500 a student. Again, 5,000 students, you're talking 1,000, you're talking close to probably $5 million, $4 or $5 million right here. Worst case is daily screening, and you're talking up 10 million. And this is just for 1 semester, right? You're talking millions of dollars just for 1 semester. And then the best case is, of course, the cheapest, because, well, there's not much community spread, so you don't have to, there's far fewer, and you can do a weekly screening. So it gives you a range based off that community spread of what your testing would have to be to have the best outcomes. But that's not all they did. They did something pretty cool here too, which is they showed the consequences, right? We think about these testings and we say, aha, we've tested them. Well, what do you do with someone who tests positive, and what's the impact of that in a school environment? Especially, and we're start talking universities right now. So what they did is they ran some looks here of, this is what it looks like, and let me clear these charts, right? In each chart on the left, you have the number of students. The day of the semester is on the bottom, so the horizontal axis is the 80 days of the semester, and the dark blue here is tested positive. The light blue is symptoms, and the gray is false positive. And you can see here, expected daily this is the expected daily occupancy of the isolation dormitory. So think of this now, right? This is under base case assumptions, right? If you did daily screening, you would have a lot of false positives, not because there's a lot of false positives from the specificity rate. There's a lot of false positives because you're testing people all the time. So you have on average 100 students at any time in your dormitory. Well, what does that mean for impact of classwork, things like that? They're missing classes. They're in the dormitory under isolation and confinement. And this shows, again, these scenarios. Now it's under every 2 days, every 3 days. And you can see here that the rate of the students that are in the dormitory overall is kind of dropping because your false positive is dropping, but the amount who are actually infected, this dark blue, right, is raising each one because you waited longer to screen them. Therefore, more people got infected and they had to go into quarantine for longer. But you can see here when you get to a weekly screening, you have a totally different behavior pattern. In systems thinking, we call this a threshold effect. When you hit a threshold effect, the behavior pattern just radically changes. And it goes from the maximum was 100 people in your dormitory to congratulations, you've infected almost a fifth of your population by the end of the semester. And again, these are students who, most syllabuses are like, if you miss 2 classes, well, these are people who are in a dormitory for 2 weeks out of the entire semester. How are they getting their class notes? How are they getting their information? Are they, how are they being treated? What services is food being brought to them because they can't go to the cafeteria? These are all really important logistical questions. And the worst case, this is the expected daily occupancy of the isolation dormitory under worst case assumptions. So now under daily screening, you again have the dark blue is the true positive, symptomatic, and then false positive. Again, when you're doing daily screening, you're going to have more people in the dormitory just by that sheer specificity rate and the sheer number of tests you're going to do. But you see that threshold effect is tripped at 3 days. And you've actually got a second threshold effect, which is a true, what we call a wave behavior pandemic outbreak. So if you are testing weekly in a college that is under a outbreak 3.5, you are going to have a mini outbreak in your university. And of your 5,000 students, 1,200 of them are going to be quarantined at one point or another. And probably 800 of them are going to be actually sick with COVID-19. And that's, that has a huge impact in how you talk about providing college services and, how are you taking care of that? And this is all after you've spent between $5 and $20 million to pay for all this testing, right? So even with these testing strategies and all this money outlay, you're talking about a semester of college. If you're doing it in person, where a big chunk of your students at any one time are going to be in your isolation dormitory, unable to participate in the physical classes you set up because this was really important. Now, the cost-wise, we'll get into when we talk about second-round stimulus. Congress is looking at cost support for colleges and universities to help absorb some of these costs, but we'll talk about that later. What I wanted to show before going to the questions on the university and colleges to, we're talking about sort of this abstracted model of who's sick and who's tested and who's in the dormitory, but we have good data now by age demographic of hospitalization. And I wanted to run through those charts real quickly to show you what this is. Now we're moving from a model, which is projected, to real world data by age demographic on hospitalization rates. So this comes from the CDC provisional hospitalization data. And I've broken this into 2 charts. I call them mid-age demographics and old age demographics. And let me clear the chart. The CDC, these are provisional too, so it's lagging data. It will generally increase over time. I've shown this one before when we had 17 weeks. Now we have 27 weeks. And every time I do this, I go back and replace all values. So if values earlier were updated, I'm capturing that. But on the left side, hospitalizations per 100,000. On the bottom, the weeks since the outbreak began. And then these lines show the age demographics, and the blue lines are sort of reference markers I put in for things that people of this age demographic tend to experience. Again, these are hospitalizations. This is not, I'm sick and I'm in my room and I'm feeling bad, but I'm going to be okay. This is not, I'm asymptomatic, no problem. These are hospitalizations, right? So these are how many people of a given population have to go in a hospital. And the age demographics here, this is the 18 to 29-year-old rate. So these are your students. Right? Think of this line here as your students in university. This is the hospitalization rate. And you're getting right now to the point where you're hospitalizing almost as many people in the 18 to 30 range as you are for asthma, and well more than firearm injuries. So COVID is now a higher hospitalization risk than asthma or firearm injuries for people 18 to 30. Your 30 to 39-year-old rate, this might be your graduate students, some of your young, your TAs, your young adjutant professors, things like that. They're now up over car accident hospitalization rates and hypertension, which most of them probably already have because they're grad students. Your 40 to 49-year-old, I like to call this the TIM category. In fact, I think if you look at week 20, maybe 19 or 20, I'm actually in this hospitalization. That's me because I'm 46 years old and was hospitalized. And then your 50 to 64-year-old rate is now, they're getting hospitalized at a rate higher than flu on an average year by a lot, and getting close to diabetes, which one is the most frequent hospitalization rates for this age demographic. But that's not the only age demographic at the school. We're talking students, grad students, your PhD students here, maybe in this blue, and your adjunct and professors and TAs and staff that keep everything are running in this. But let's go to the tenure track professors, right? They're in what I call the old age demographic. That may be unfair to tenure track professors, so it's a little bit hyperbole, but the tenure track graph shows age 65 to 74. Maybe they're still professing after that, but I also included the older age. These ones have really increased since I last did this chart, and it's important to understand that the hospitalization, as this continues to spread, the per capita hospitalization rate is still increasing. It's got a little bit of a gradual leveling out now, but it's not flat. And so here I've upped the scale. Notice the scale now is a lot higher, and it starts with hypertension, average influential diabetes. The 2018 influenza was the worst in recent memory, so I put that out there as a preliminary. Congestive heart failure. You've got some hospitalization rates. Now, granted, this is an 85 plus. They're probably not going to be in the professor ranks, but they may be in, but your green line here, definitely your professors and administrators. So this really, that first model showed what would happen to the students, and it was kind of, well, they're in the dorms or isolated, but this is showing hospitalizations. You're going to be managing hospitalizations in a university. Even if you're opening and testing frequency, you're still going to have, key people, from key students to staff, TAs, adjuncts, professors, administrators. All of these folks are keys to running the hospital, and they're all going to be going in and out of being sick and requiring hospitalization at some rate. This is not a non-dangerous pandemic based off your age rate, as we're seeing now. So yeah, and let's pause here, because this is the research I wanted to show. This is very difficult to correctly open a college under these conditions, right? And some people I'm already seeing are saying, like, well, what's the likelihood of kids behaving responsibly, right? We're talking, I mean, there's a poll that came out. I haven't dug into it, so I don't want to but it's saying kids are saying they won't go to parties. And I'm like, okay, great. That's nice they say that. But when they get invited to a party, the question is if they're not. I mean, this is all at a high level, not very tactical, not down in the weeds. And it shows the infeasibility of a college campus. From a cost standpoint, you're spending $5 to $20 million testing, and testing has to be spot on. If you screw up your testing and miss people, all these numbers are off, and they're off to the worse. And for a result, you're still putting a lot of people in an isolation dormitory, because there's going to, the more you test, the more false positives you're going to have by that specific rate. So they're going to be missing classes anyway. You're going to have some people who get hospitalized and need to leave the environment and be taken care of and may have to be replaced. So this is really going to be a struggle. Yeah, Jerry Spalding's asking, ask kids if they want to learn from home or get a swab jammed in their nose every week. I had 3 swabs when I got COVID-19 and went into the ER and got hospitalized. I had 3 swabs in about 5 days, and I was feeling that for a while. That was not fun. Getting and I don't know of any test right now that doesn't involve nasal swabs. Getting a nasal swab every day for an 18-year-old or a 20-year-old, even for a 40 or 50-year-old who knows that this is important, that's not physically comfortable. That's going to cause a problem. Do they then add cost of testing to process of tuition? Yeah, so a lot of people are bringing up that this is all assuming perfect cooperation. That's the one flaw of this model, is that it sort of says, if we have a slot for testing someone, they'll show up, they won't miss it, we won't have to track them down and find out where they went and get them back in. We all know in colleges that doesn't if you've ever had a scheduled counseling appointment with a kid, student, I should stop saying kid. If you've ever had a scheduled counseling appointment with a young adult learner and had to reschedule those, you know that the scheduling is somewhat flexible at best when you're this age. So it's going to be very, very difficult. So wow, there's a whole lot of comments here. Wow, okay, so we will probably not be able to get through all these comments necessarily, so I hope I'm not missing questions, but this sets the stage. So everything I just said is sort of the background context of this White House rule that was issued on foreign students would be banned from being in the US if a college was only doing online. This is the reality that I think colleges, as they struggle with this and navigate it, a lot are just saying, screw this, we're going online. Well, about a week ago, or not even a week ago, the White House issued, so here's some context, right? There's been a long-standing ICE rule that if you're a foreign student attending in the United States at a university or college, but you cannot just attend online classes. And the origin of this rule actually goes back to our last crisis. It's an after effect of the 9/11 attacks. There was a real concern after 9/11 that some of the terrorists had come in and attended flight schools but never showed up in person. They were not getting checked on. So a rule came out that has been in effect for a long time that you could not be a foreign student studying in the United States and simply take all online classes. In March, ICE suspended that rule because of the pandemic conditions. Makes sense, right? No one's holding classes. The White House guidance, which only came out late last week, was they were going to reverse the suspension despite the pandemic surging. We're talking new caseloads of 50 to 60,000 a day. The death rate's reversing. We all know that deal. But what happened is this really unified opposition to the White House's policy. And the reason why is it's like the golden rule. They who have the gold make the rules. And I think the important context here to understand is that foreign students make up about $41 to $45 billion worth of the US economy. And they are the bread and butter of a lot of universities, because if you think about it, if you're most universities have in-state tuition, out-of-state tuition, they have scholarships or federal loans. There's a whole lot of things you can do. Not that I'm saying it's cheap, but there's things you can do to manage tuition costs if you're a domestic US resident or citizen. If you're a foreign student studying in the United States, you tend to pay just full boat, full ride. And I think a lot of universities and colleges have been sort of relying on foreign student attendance to prop up an enrollment where the costs of college admission would have traditionally, we'd seen declining enrollments, but instead they've been drawing in students who tend to be from the upper classes of places like in certain Asian economies, especially China, Middle Eastern economies, especially Saudi Arabia, where you have the upper 1% or 2% of those economies, they're sending their children to study into the United States because it's considered a top-notch education, and then they return with that education. So how much of the university enrollment budget? Well, the numbers I found are a little old. They're from 2015, but the link's in the thing. 12% of all university students are foreign students studying in the US, but they make up nearly a third of all college and university revenue by fees. So that tells you if this had gone into place and they had just banned all students that couldn't, you are basically looking at universities losing a third of their budget in a pen stroke, or having to go in person, pay out these huge outlays of costs with testing that may or may not be reimbursed by Congress. And pretty much everyone came at this with the kitchen sink. All the universities, MIT and Harvard were the first ones to file a lawsuit. They were joined by a host of universities. I think 350 universities joined them. There was a second group of Ivy League schools that followed a separate lawsuit. 17 different states filed lawsuits. The U.S. Chamber of Commerce, not exactly the world's most liberal bastion, came out against this because of the economic impacts. And this was probably one of the fastest turnarounds since Trump dropped the Kurds. I mean, this thing was pulled out and removed in a matter of days, but it still had an impact because students were being stopped from returning at foreign points of entry if there was indications that their school was online. ICE was already beginning to enforce this, which means there's some students who are going to have to be sorted out and allowed back in. Hopefully that all gets worked out. But this is really speaks to the challenge and I think the trickiness. Once you start talking about young adults, schools, and children, you're kind of touching a live wire. And that brings us to the next section, which I'll pause here. If you haven't yet, share this video out if people are interested. Like and follow the InfoMullet Facebook page if you haven't already. And if you like this kind of context and information, you like this data analysis, please consider becoming a Mulletary subscriber. $5 a month, www.patreon.com/infomullet. I have to put these pitches in because otherwise I have friends who will hit me over the head. But we do appreciate all the subscribers in the Mulletary. So if you haven't yet, just check it out. They're on Patreon. But let's get in now to, so that's universities, right? We're talking semi-adults, I should say, fully adults, semi-functioning adults. As a student body, we're talking about professionals and administrators and all those, and it's looking tough there. Now let's shift the perspective of reopening schools down into high school, middle school, elementary, and kindergarten. Now, this is where we're really talking about that predicament state, because I want to start up front. I understand that these schools over time, the US economy has often relied on schools to provide social services that are not being provided through other means. We're talking about meals, counseling, support. There's all sorts of critical services that are IAP programs, right? Therapy services. These are all being provided by schools. And when schools aren't open, these services are either difficult or impossible to provide. But what happened is there's also some soft benefits. I mean, no one's going to say that in a perfect world, we wouldn't want necessarily kids to be, there's socialization benefits. There's time dealing with peers. And what happened is kind of the American Academy of Pediatrics kind of stepped into it in late June, because they came out with a guidance that really, it was timing wise. I'm sure they were developing this guidance as a bureaucratic institution does. It was probably being developed in May and early June, right? Going through approvals, and the pandemic looked like it was in a lull then. And they came out very strongly in favor of having kids go back to school. And they called it a catastrophe if they weren't in school. They said, here's this litany of problems. Social inequality will get worse. Abuse will get worse. All these things will get worse. And then that report came out right as the cases began surging. I mean, we were already in wave 1.5 from Memorial Day on, but it wasn't as apparent unless you were closely looking at it, until late June. And this report came out it probably didn't get that much attention when it came out, but a week after it came out, the president issued a threat using this report as justification. He said, any school that doesn't open is going to have their funds stripped from the federal government. Well, first of all, whenever you brief a principal, and I've done this in the military, you got to explain to them how the world works and how it doesn't work. There are certain things that can and can't be done by any principal officer in the United States government. I don't think anyone's like that doing that in the White House. The president does not have the ability to strip funds from school. And indeed, the federal government does not supply the majority of funds to schools. Something like 90 to 95% of local school budgets come from local city, state funding sources, a lot of it through property taxes. So first of all, the fund spigot that if he could have a handle on is fairly small. Doesn't mean it wouldn't hurt. There's a lot of programs that are like, that give other sort of funding to school. But, and I also think that he couldn't just unilaterally remove that funding either. So he stepped into it. He took the AAP report and said, see, the best experts are saying we need to open. And this then caused what I call the French pivot. And a French pivot is when you're going in one direction and you pivot into the opposite direction and begin heading that way. And the AAP began executing a French pivot on July 8th. The president of the AAP got on NPR to do an interview. This was about 2 days after Trump issued his threats and said, well, let's not be hasty here, because they were asked directly, well, what about Florida? You have record-breaking cases. He goes, well, in Florida, if you have surging cases, you obviously need to be careful. We're not trying to suggest that you should open a school in the middle of a pandemic. And then probably a couple days ago, July 10th, the AAP completed that French pivot and came out with a clarification that emphasized physical safety is paramount, and that local COVID-19 community concerns would have to. So this really was a reversal of saying, it probably what happened is the original guidance was written under the assumption that pandemic's over, cases are declining, we're good. Let's reemphasize all the good benefits we get from being in school. But what happened is obviously wave 1.5 happened as predicted, or at least as predicted by me. And the cases surged, and they realized that this guidance in the context of surging cases looked like they were saying, go back and put your children in harm's way. And now I don't have a good model of what it looks like to open a daycare or a high school or simulation or something like that. But what I do have is a very large study that just came out of South Korea that talks about the risks of infections of kids. Now, this is in the links, you can find it, but what they found was that it was a very large study. This is a preprint study. So again, this is still going through peer review, but this was a study that included contact tracing of 65,000 people in South Korea during the parts of the outbreak. And because they were doing contact tracing, they have a lot of good data on what the pass-through rate, the infectivity rate is for different age groups. So if you trace a person and you follow that person through their contact tracing and you start looking inside the household, you can start to see transmission rates. And because they were able to break it up by age demographic, they have a lot of good data. And what they found was that, as we suspected, Young children have passed the virus on less than adults, but it's not at zero. It's probably like 18%. So it's much less than the adults, but that's only children 0 through 10. When you start getting into young adults aged 10 through 17, 10 through 18, they're passing on the virus just at the same rate as if they were adults. So when we talk about elementary and public schools, we might be able to distinguish a little bit of the threat just from a sheer passing on. But keep in mind, past studies have shown that even though this lower infectivity rate by a percentage, younger children in an environment of school are going to have higher contact rates. That may wash out this difference entirely. And I think it's important to understand, both with the university model and with the elementary and public schools discussion we're having, how these infections and testing and quarantines need to happen to get the best effect. So this is actually coming from Harvard research. This, again, the link's in the bottom. And what it shows is the causal chain of 3 infections. And to break it down, it's got the SEIR, susceptible, exposed, infected, and recovered. This is the model we've been using since January, SEIR or SIR. And what it does is each of these horizontal lines shows an infection pathway. And what it starts is the primary patient is infected at E, and over time they have a symptom onset at I. This is when they become symptomatic, if they become symptomatic. They get tested and isolated at the second I, and then this is the testing and tracing delay time. This time is crucial because this is the time you realize by the time we understand that they're positive, they have already infected the next person in the causal chain, and that person is going through the incubation and may have just got an onset of symptoms. At the time we tested the first one, this person is beginning to become symptomatic, but we can find out in a contact tracing, we can identify them, we can test them, we can get them to self-isolate, and then when they're self-isolated, what that does is that breaks the cycle. This third chain here shows that they could have exposed here, but if you can cut it off, the sooner you can get these contact tracing, the less second, third, fourth order folks you can have get infected by this. And this is really critical. This is why in that university model, you would have those outbreaks, and they found that the best testing models were more frequency. It's the time delay of how frequently you get tested to ensure that you're not having an outbreak. And from this data, Harvard has put together some community guidelines, and this is also pulling from what the CDC has, and it's starting to look at what are the different data and information we can take from a community to understand in terms of school safety. So in Harvard, they have several levels: red, orange, yellow, green. And this may look familiar to folks. A lot of communities are going this. So I wanted to walk through this because if you're a public school teacher, you probably need to know what this is and where the data comes from. But it's a risk level somewhat similar to the terrorism alert level. It's green is low risk, red is high risk. The case incident is the daily new cases per 100,000 people. So if you're at less than 1 per 100,000 new people, you're going to be in the green. And if you're up at over 25 cases per 100,000 people, that's a red. And what it does is it talks about the intensity of the control effort necessary in the community. So red is stay-at-home orders are necessary. Orange is strategic choices must be made. Green is you're on track for containment. But what's important about this Harvard resource I'm providing is it also shows here, how do you get from red to green, right? And there's a lot of data in here. The whole report's in the bottom, but they break it down, and if you're at maintenance and green level, this is what you should have in terms of your tracing capabilities, and later I'll go into testing. Suppression is if you're trying to reduce it to zero. If you want to reduce your outbreak to zero, you use the suppression column. And if you're trying to do mitigation, if you're just trying to reduce it a little bit, you want to use this level over here. But notice the number of traces. For all three, you need about 30 tracers per 100,000 people, or 1 per 4,000 in sparsely populated areas. On the yellow ones, it's still 30 traces per 100,000. But if you have an activation, if you have a surge, you either need 30 traces per 100,000 or 5 traces for every new confirmed daily case. So this would say if you had a town of 100,000 and you have 25 new daily cases per 100,000, which is that red level, that would say you need 125 tracers because it's surging in that area. This also lays out the trace time, the percent of time. How fast do you need that trace time from when I from when we identify who is infected to we've traced all their contacts they had. Remember, in that model I showed, or with the horizontal, that's that time delay that allows you to self-isolate and get people out of there. If you think about a school, if you find out a teacher's been infected, how long does it take to test every staff member, every fellow teacher, every student of those fellow teachers, to be able to go in there and begin getting them isolated out of the population so they're not infecting everyone else? And it says here, the rules of thumb are within 24 hours, you need to have traced 90% of their contacts or greater. That's a very high requirement. And from a testing standpoint, it also points out this is where our positive test ratio numbers come from. If you're suppression or mitigation, this is where we get those 3% and 10%. If you're just trying to reduce it, you need to be less than 10%. Well, right now in the US, we're about 8% on average. But if you're trying to get to zero, which is what you probably need to do to get schools back open, is you need to have a suppression strategy, it should be less than 3%. You know, when we say about schools, that's going to be a local choice. Am I going to open my school in a local community? And for that, you need to understand the contact tracers and the testing percentage in your area. And we have a resource for that. I've shared this before, and it's the Test and Trace website. Again, the link's in the bottom for any educators or administrators that want to look at this. Go ahead, check out the link in the bottom. But if you're actually looking for more detailed, if you scroll down here, this is pretty useful. They have every state in the country, and you can simply sort. Remember that chart where it said under 10% or under 3% if you're going to zero? Well, right here, percent of tests that are positive over a 7-day moving average. We sort on that. These states here are telling you where you've got good suppression. Remember, under 3% is suppression. That means you're heading to zero. So you've got a list of states that are getting close to that. And it also lists the number of contact tracers per 100,000. This is a little iffier, right? You can have good testing, but if you don't have enough contact tracers and you have a large increase or a surge, you're not going to be able to keep up with it. So Connecticut looks pretty good, 24 contact tracers per 100,000, under 1% testing. That's pretty good. But look on the flip side. So let's test this now, right? Arizona, 24% positive. Idaho, 19% positive. Nevada, 18.5% positive. And look at their contact tracers per 100,000. They're not even in the ballpark. They need 30. They have 5, 14, 13, 3, 7. This is why these states are surging, and this is why you shouldn't open schools, because they don't have the capacity to do the testing and tracing to the levels that are necessary. And this is the risk that we talk about, because with all of this going on in the community, again, from that study in South Korea, we know that both children and young adults can pass on the infection. We know that. It's just at differing rates. For children, it's much less than adults, but for those 10 to 18, it's going to be about the same as adults. And yeah, Ed Cook says, how many tests do we need daily to test all these teachers and students in the public elementary school system? I mean, that's great question. So Ed, fantastic point. I actually polled from the U.S. Bureau of Labor Statistics the estimates of how many teachers and staff are employed. Let's pull that up here. So it is, this data comes from the U.S. Bureau of Labor Statistics. It's from 2017, so a little out of date. It breaks it down into teachers, instructors, in elementary and secondary. These are people with direct interaction with the kids. So you're thinking testing here, you might want to have daily or every 3 days. This is 5.5 million people right here in this group, and you can see how it's broken down. But it also goes, schools don't run themselves just on teachers. There's staff and administrators and janitors and all cafeteria folks, bus drivers. There's about another 2 million there, and these may be able to get away with 3 tests a week, maybe once a week. But think about this. If we have 7.3 million instructors and staff in elementary and secondary schools, that's 3 million tests a day if you want to test every 3 days. And the current high nationwide is 850,000 tests a day, and that was 2 days ago. So if you want to test successfully, have this testing strategy and reopen public schools, you've got to just about quadruple our current testing rate and have them all go to staff and instructors in elementary public schools. And that's not even counting the students. There's probably about 50 to 60 million students in the country, and I don't know how frequently you want to test them, even once a week. It would swamp our testing capacity. So, I mean, this leads to the next topic, which is To me, there's only one safe way to reopen schools. In systems thinking, we talk about a null space for solutions. When you have you think about a space where all your solutions lie. A null space is an area where no solutions can be found. And this happens in complex problems. You have certain things that, when I was advising the military and we were deploying in Iraq and Afghanistan with so many brigades, and we said, we only want them for so long over there and they got to be home for so long, and there's a fixed number of brigades we have, we went back to the generals and said, this can't work. There is no math. There is no combination of techniques and tricks that will make these numbers work. And I think the null space for school reopening is when you have a pandemic outbreak, you cannot safely reopen the schools. And what that leads to the conclusion, and this is why I'm not getting into desk spacing and things like that, the path to safely reopening schools cannot be found in the schools themselves. It can only be found in reducing the community spread within which the schools occupy. That means the methods that are going to be most effective for assuring safe reopening of schools is to reduce the spread rate in the community within which the schools occupy. That's the only way I can see to safely reopen schools and universities. And it gets right back down to that pandemic response. What is the community doing about masks, social distancing, keeping things closed that need to stay closed, testing, contact tracing, all those elements of community? Those are the tactics that determine whether schools can safely reopen or not the distance between desks or the shielding you have. And this is, again, my opinion. Other people will have different opinions, but I kind of use it like a forest fire analogy, a picnic and a forest fire, right? If there's a forest fire going on and you want to have a picnic in the middle of it, if you have infinite resources and engineers and smart people, you can probably design a way to have a safe picnic in the middle of a forest fire once. The trick is doing that multiple times gets really difficult because each time you do it, there's a risk something goes wrong and then the results are catastrophic. There's very little margin of error on the downside where you're allowed a little slipshod of, hey, and we know how schools and universities are with, dealing with all these different aged folks, right? There's very little margin for downside, but there's catastrophic results for failure on the upside. And so the forest fire picnic analogy is, sure, you could potentially engineer a way to have a picnic in a forest fire, but why would you want to? You stop the forest fire, you put the forest fire out, and then you have as many picnics as you want. That's, I think, the paradigm shift here that people need to get around and the policymakers need to get around. And I understand that with schools, there's been this push to how do we reopen? And it reminds me of the push that happened 2 months ago with the economy. How do we reopen the businesses? How do we make businesses safe so we can do it? I think, though, we're going to see the same effect. If we continue to push by, this push to reopen schools, because we think we can, we're going to be in the same situation we're now seeing businesses in. We pushed businesses to reopen. They reopened, cases surged, and now the businesses are closing again. So if we reopen schools, and I know some of them are going to be opening here in the next month to month and a half because of timing and decisions are being made now, and it's like, we can't wait, we have to decide now. My prediction is any school that opens is probably going to face a serious risk of having to close again before they have completed the first semester of the school in which they reopened for. And that may be different in some states, like if Alaska gets its case control or Hawaii, these isolated states. But when you have 60,000 cases in the continental US every single day, there's a ping pong effect. At a macro level, the North and Northwest and West had the initial outbreaks, and the South, Southeast, and Midwest didn't, and they got lax. And then the infections from those areas spread and provided the reservoir that then caused the infection outbreak we're seeing now. And just as the Northeast and the Northwest now it looks calm, it looks better, things are reclining. You cannot get lax because now you have a reservoir in the Midwest, South, and Southeast, and you may have the same effect in reverse. I call it ping pong. We may be ping ponging the infections now in the southern part of the country right back into the Northeast and the Northwest by late summer, fall, simply because if people are lax, just as if they were lax in the South, they said, hey, no biggie, we're past this, whatever. If you're lax in the North and the Northeast, you're going to have the same effect. And to schools, you're going to see them open only to have to close again if that happens. And I feel bad for saying this because I'm not saying there's an easy answer. I'm not saying there's not consequences for keeping schools closed. But I think as the earlier schools that open, they're going to have cases the media is going to report on. They're going to have children in hospitals. They're going to have staff in hospitals. They're going to have parents pulling kids out anyway. Homeschooling is going to become really popular really fast. And the entire premise of why we are doing this begins to fall apart. And so my advice is, you know, the pathway to safe reopening schools is the same pathway for the safe reopening of business. It's the same pathway because it's the pandemic response. You have to get the pandemic under control. And until you do, you cannot engineer a safe way to have a picnic in a forest fire. And that's, I mean, I'll go through and answer some questions, but that's my take. Oh, there's so many comments here. I'm not going to be able to keep it up. I apologize if I'm missing questions. I love that there's great discussion, but there's so many. I apologize if I miss questions. It's a good discussion. I apologize if I'm missing questions. I'll try and see if we can do this and answer them on the thing. Someone asked if we can get this clip up fast. I can do this and try and get it up tomorrow. Normally, we put the full clip up on Friday, and then put the segment and clips up the Thursday after. But I understand this one's a hot one, so I'll try and get this out soon. Mullets are considered important when presenting to school boards. I mean, I present to generals with this hair, so a principal can deal with it as far as I'm concerned. Sorry, that's just the way I am. All right, so let's talk, again, really important, the second round of stimulus for the government. Not that schools aren't important. I know there's probably a lot of good questions in there, but I wanted to get these other two topics covered. So this question of stimulus, right? And I don't like the name stimulus. I use it because everyone else uses it. It's not really stimulus when you have a pandemic, right? The pandemic is like a meteorite hitting the country. It's like a foreign army invading. These are exogenous events that there's not a real moral hazard like there was in the financial collapse that you had banks acting badly and that led to bad things, you know? But stimulus is the name of it. And the first round of stimulus, the CARES Act, put in place a lot of provisions which are expiring. There was a one-time check for $1,200 to people. There was a $600 a week add-on for unemployment. These are largely, you know, the $1,200 check was a one-time check. The unemployment is expiring here at the end of the month. And obviously the pandemic is surging again because we didn't get our stuff together. So there's a lot of discussion on where is the second stimulus round at and what does it mean. So first of all, from a media literacy standpoint, if you're looking at politics, the two sources I mean, I use a lot of sources, but the two ones I use are Politico and The Hill, and I use them for different purposes. The Hill is where I go for like committee level reporting of what's going on that week or that day, very tactical, who's got what in the bill, who's horse trading with who, what's going on in the committee meeting. The Hill is very good for that, thehill.com. Politico, I use for a little bit broader view. What's the political trends? What's some of the policy discussions going on or the strategy? And so you can read both of those and get a pretty good feel as a stimulus bill comes forward. The Politico will tell you like where the parties are lining up. The Hill will tell you when the committee meeting is and what happened in it. And so what happened was after the CARES Act was passed, the Democrats in the House passed something called the HEROES Act, because all bills have to have names like CARE and Hero and Apple Pie, but I shouldn't blame it. All parties do that, right? It's always the orphan and anyways, bills get named, all sorts of great stuff. But the HEROES Act was passed in May, and the Democrat, and that was only passed in the House. The Senate hasn't passed it yet. That proposed another $1,200 check to anyone making $75,000 or under, phasing out at $90,000. The GOP has countered that, and they remember Senate is in recess right now. The House and the Senate are in recess, or the House may not be in recess. The Senate is recess because they're not in because of this pandemic and normal summer recess. They're coming back in next week. So the GOP is countering now from a stimulus check. It looks like there will be some sort of stimulus check, but the difference is the GOP is saying rather than 75,000 and under, they want it to be 40,000 and under. So there seems to be some consensus on that as a concept, but difference on where it falls. Tyler, Mulletier Tyler, our great investigator of the failures of RT.Live, had pointed out this thing called the vacation tax credit. And that was That was I chased that down. What this was a lead turd of a policy balloon floated in mid-June that instead of a stimulus, there would be a tax credit called the Exploring America tax credit, that if you traveled the country, the money you spent traveling on the country could be used as a tax credit that would then be used in place of stimulus. That thing went down faster than the Titanic, because it was just, tax credits are at the end of the year. They're complicated. They tend to benefit the wealthy more. Not a lot of appetite. It was pretty much DOA. So it looks like they're going now for the stimulus check that was like in the CARES. You get a check. Although it may not be signed by Trump this time. There's a bit of a kerfuffle going on between Senator Schumer and the White House about who signs what and what signatures there. But anyways, there will be a check. It'll be $1,200. What matters is how much you make. If you're 75,000 under, you'll probably fall under the Democratic plan. 40,000 under the GOP. Unemployment. The unemployment, where there's consensus, there seems to be consensus on the duration of unemployment. Most states go to 26 weeks. Unemployment, but often there's a federal emergency that will kick that up to 39 weeks. There seems to be consensus between Republicans and Democrats to have federal support to extend unemployment through that extra time. Where they differ dramatically is that the federal addition, it was currently $600 a week federal addition to the unemployment. That's being said, the GOP is saying that's a no-go. They don't want to have unemployment benefits any higher than 100% of the pre-unemployment wage rate that someone had. As a federal addition. And without these extender benefits, without these $600 federal, you're looking, if nothing gets done, so this one's a bit of this is a little more hot potato than the stimulus check. If this doesn't get passed, unemployment will drop from where it is now to an average of 333 a week, with a low of about 101 in Oklahoma, with a high of about 531 in Massachusetts. Again, states vary widely in how much they provide unemployment, and it's also based off your previous wage, but there are often caps that are far lower than what your previous wage was. So if the Republicans say, well, we're willing to add federal money, but only up to your wage cap, they may help in some states where the unemployment is artificially low, getting you up to your wage rate, but it's not going to get you above your wage rate. And I think that's the really hot point of contention. The GOP is also trying to limit this to about $1 trillion. So, I mean, that's a big number. So it's not nothing, but that's a smaller than the HEROES Act. And they've also thrown in some of their things now that are going to become negotiating points. They want liability protections for business and hospitals, except gross negligence. If there was gross negligence, doesn't apply. But general liability protections for COVID-19 related lawsuits from 2019, so going back in the way back time, through 2024. So they want to cover a liability protection. They want to put in $75 billion for schools and universities to absorb the cost of reopening. That's not new. That was in the HEROES Act by the Democrats as well. They're also looking at extending a second round of payroll protection plan. This is the PPP that was designed for small businesses and probably did a large degree to help keep some businesses afloat, but it was also exploited by large companies that sort of fell within this, 500 employees. So right now what they're looking at is reducing the employment rate so that it really is targeted for smaller businesses. Full disclosure, I use the PPP for my business, so there's my bias. It wasn't easy. They're also looking at about $150 billion for states. Again, we've talked about that states, even before COVID-19, were not in good shape from a standpoint of their unemployment pension or their unemployment and their pension fundings, and they're really being hurt by that. Both the Democrat and the GOP are looking at some money for states. It's a difference of how much and to what extent. But that looks like that will be negotiated here in the next week or two as we get into and this will be the big thing. I think school reopening, if I were to make a forecast of the next 4 weeks, Congress is not going to want to touch forcing schools to reopen. These cases are going to increase. They're going to do it. We're going to have those initial ones. And they're going to probably not want to touch that because nobody likes their kids being threatened. I don't care, blue, red, whatever. If you perceive your kid being threatened, it's bad. They're going to focus on the second round stimulus, which means we're going to see a lot of news back and forth. Yeah, Jules has this great comment that the Explore America is a tax credit for spreading the pandemic. What could go wrong? That's a good point. Adam's asking, shouldn't federal government send stimulus to the state's government rather than directly to the people? That's generally, there's two schools of thought on that, but when you think about a multiple propensity to consume or a marginal multiplier rate, that's the rate of which if I send you $1 how many dollars will that spur in the economy? So that's a number that economists use to judge the efficiency of things like stimulus or whatever, the business investment. It's used in all sorts of as a measure, but it's basically saying if you had an MPC of 5, I think it is, and maybe that acronym is wrong, but it's your multiplier. That means if I pay you $1, that $1 will act as $5 as it ripples throughout the economy. And that multiplier is higher for direct people getting their checks than it is giving it to the state. Because unless you add a lot of riders to the state can just absorb it in the budget. It can use it to shore up shortfalls. And so generally what an economic policy is, and I'm not going to get in the argument of whether multipliers are good or bad, because there's a valid debate of whether those numbers are even right. But I think right now we'll just say that they're using that measure. But I think the preferred policy approach is to fund states with what they want states to use goes to directly in state support for things like the pension and shoring up the unemployment and doing things like infrastructure project, kind of like the 2010 stimulus bill put a lot of money into the states for shovel-ready projects. That was a disaster, but second order effect discussion. But stimulus, direct stimulus, they send the check directly to people. And when you're talking about a pandemic, one of these externalities where there's a hole, I describe it as a hole and you're shoveling to fill the hole, and not in the economic sense of we're paying people to dig holes and fill them. That's a different analogy and wrong. It's more like you're sending this money out so that people can eat, they can consume, they can provide, they can pay rent. It's to help with those things, and that keeps things going, because what you don't want is the economy to seize, because so many people are unemployed, so many things. We're in a risk of so much different factors causing the economy to seize more than it has, and then restarting it will be very difficult. Yeah, I have something to say. Tyler's asking a question. Do you have anything to say about COVID reporting not being given to the CDC anymore per the White House? What Tyler is talking about is just this morning or last night, the White House said that reporting of hospitals will no longer go directly to the CDC. It will go instead to the White House. I think this is a terrible idea. I don't care what administration it is. Whenever you adjust the normal course of reporting, forget all politics, right? Just say, from a statistical data reporting standpoint, if you have a mechanism of reporting and it's been going along in a certain way and you change the way that mechanism exists, you are going to change by sheer dint of the procedural change, the error, the adjustments. You're going to have to put an asterisk on everything that gets reported in that new pathway after. And you see this. I do this for uniform crime reporting for the FBI, right? The FBI has all these asterisks and footnotes that says, we changed our reporting mechanism at this date. So be careful comparing anything before to anything after. This is just the nature of data reporting. Now, obviously, I'm concerned in this administration, which has tended to want to diminish the extent of the pandemic, that there'll be a suppression of the numbers. What I don't know is whether the hospitals are still reporting to the World Health Organization now that we've withdrawn. So I'm going to dig into more of what the practical implications are. It may be that hospitals can still choose to report to the CDC. They may do it as an act of resistance. There may be some shadow group set up that's basically taking the information from the hospital as its own. I think in general, it's a really bad idea to have independent reporting consolidated into a political, and the White House is political, into a political function. So I think that's a generally bad idea. Someone's here replying here with good information. Randy's pointing out, Randy's pointing out a good clarification. So I want to read this. The National Healthcare Safety Network is the CDC systems for gathering information. But it's not the notifiable diseases surveillance, which is the central repository for the CDC. Data will still be sent through these entities because it's required by law. So this is a good point. When something is required by act of Congress, like you go and look up a statute and it says you'll report this to the CDC, the White House cannot change that without an act of Congress, even if they do an executive order. So if it's a statutory requirement, then that will probably mean that you'll have two directional reporting, and you may have a conflict between White House numbers and CDC numbers. But if there's a statutory requirement, you still have to report it to the way that the law is written. Now let me go through before I get to South China Sea if there's any other questions. Okay. A lot of the questions were about the CDC. Again, the comments are great. The discussion is great. I love this. I'll get back to it. We're at the top of the hour. One final foreign affairs thing that is going to have a major impact to the economy because it's 2020, right? This is like the murder hornets of economy. Last week we talked about the South China Seas update and the conflict that was brewing there, or tensions, I should say, between the U.S., China, Philippines, Vietnam, Japan. The navies are circling around each other. These disputed territories had always been they'd been informally recognized as. Let me back up. The United Nations, the world courts, had formally recognized them as illegal. But the United States had never made an official claim because in the world of diplomacy, if you don't say something clearly, that gives you room to maneuver. So right up until a couple days ago in the South China Sea, the U.S. had clearly signaled we're going to keep free lane opens. We're going to have the free maritime. That's always been a big strategic focus of the U.S. China saying this is our territory. We're going to force everyone out. Earlier this week, the State Department formally upgraded its guidance to say, we are now officially denying China's claim to its territorial waters. We do not think it is legal, and we are denying that claim. It doesn't seem like much, but that has set in place a kind of series of events that are going to have a pretty significant economic impact. And this is going right on top of the Hong Kong national security law. So all this is happening. Shortly after that happened, the special status of Hong Kong was removed, which means Hong Kong is now under any sanction or limitation that applies to China, also applies to Hong Kong. That has a big impact in business. The US is also now advising companies that use supplies in China may be under risk of falling afoul of US domestic laws and policies. These have always been in place, but they haven't been enforced. So you're talking about companies like Walmart, Apple, and Amazon that are now looking at having to move their supply chains out of China. China, of course, is not sitting down for this. They're saying, and this is kind of a multi-front thing. You've got the diplomatic side with the State Department saying we don't recognize your territorial waters. That's a slap in the face. You have this economic thing where we're encouraging American companies to pull their supply chains out of China. China's going to retaliate with their economic muscle that they can and their economic influence. So this South China Seas thing may be the dark horse sleeper tension thing, conflict of the summer, because it's not COVID-19, it's not a shooting war, it tends to lie under the water, but it has a really big economic impact because all of these trade lanes and supply lanes, they would have to be reconfigured in the middle of a COVID pandemic when most of the countries in the world won't even let US people travel to them. So reconfiguring the supply chain, even if it was under normal circumstances, would be a challenge. Now you're doing it in the midst of this pandemic. It's going to be really tricky. So that's going to be something that we're going to have to keep an eye on. Again, if you haven't yet, follow the Infomullet. If you're new here and you like what you're seeing, we do this regularly. I'm gonna start doing these once every 2 weeks. I've been doing them once every week while the pandemic was in full outbreak. I can't keep that pace up anymore. I've tried to keep it up, hoping that the pandemic would wear down. I've got to shift to once every 2 weeks, but in return for that, I'm gonna shift to more written articles, which have been backing up. I've got a ton of backlog of written articles. So the next one of these will be on the 29th of July. The next Facebook Live Ask Me Anything will be on the 29th. And in return, I'll be adding some Infomullet blog articles, which are the written articles. So again, if you like what you're seeing here, you like this context, we'll put the full video up on Friday. I may get a rush clip out tomorrow on the school ones, and I'll put that on the Facebook so people can see it, because that may be important. But generally, we release the full clip on Friday, and then all the individual clips the Thursday after, and that's kind of the pacing we do. But if there's not any final last questions, I'm going to close it down because we're at the top of the hour. Hopefully this was informative, and the bottom line message is I don't think it's safe to open schools. I think it's like and engineering a solution is like engineering a picnic in a wildfire. The correct approach to opening schools is the correct approach to opening businesses. You put out the wildfire first, then you have your picnic. So I'm going to leave it at that. Everyone be safe, be good. If you stay inside if you can. If you can't, wear a mask, and enjoy your week. Take care. Thanks for watching the video. Hope you enjoyed it. If you'd like to follow the Infomullet, visit us on Facebook or Twitter. And if you'd like notifications when we post new video content, click on the red subscribe button below the video. If you've ever wanted to become a mulleteer and support the Infomullet, visit us on Patreon. We appreciate the support.